It is my honor to address this gathering, and I bring you greetings from the people and government of the Federal Republic of Nigeria. I would like to express our appreciation to the World Health Organization Director General, Dr. Margaret Chan, the Bill and Melinda Gates Foundation, and the Minister of Health of the People's Republic of China for the opportunity to participate in this unique meeting, which is focused on charting the roadmap for a more effective and efficient approach to the control and prevention of the menace of MDR, XDR-TB. Indeed, the meeting is most appropriate at this point in time, when the threat of MDR, XDR-TB has not only assumed an alarming global dimension, but poses a real threat capable of obliterating all the achievements made over the years in the control and prevention of TB. For us in Nigeria, as in other sub-Saharan African countries, the true magnitude of the MDR-XDR-TB is in the process of being determined through the conduct of country-wide drug-resistant survey. We are working in partnership with the WHO, the CDC, USAID, TB-CAP, and other partners, and preparations have reached advanced stage to conduct a drug-resistant survey before the end of 2009. Mr. Chairman, WHO estimates have shown that about 1.9% of new TB cases and 9.3% of retreatment cases are MDR-TB cases. These translate to an estimated 1,522 and 570 MDR-TB cases among new and retreatment cases in Nigeria. Furthermore, some limited and isolated institutional data have shown that between 2006 and 2008, a total of 80 confirmed MDR-TB cases have been documented across the country. These figures have clearly shown that MDR-TB and other varying patterns of drug resistance are already emerging in Nigeria. Undoubtedly, the current data evidently show that MDR-TB is a public health emergency, and the government views this with all sense of seriousness and responsibility. In recognition of the threat of MDR-XDR-TB, the federal government of Nigeria inaugurated a high-powered national MDR-TB committee in May 2007. It is charged with the responsibility of providing technical support and charting a roadmap for the control and prevention of MDR-XDR-TB in Nigeria. Permit me at this point to mention a few of the achievements of the committee, and these include the development of a national MDR-TB operation plan for 2007 to 2010, the development of the national guideline for the control and clinical management of MDR-TB, the development of training guidelines for field workers on the control and management of MDR-TB, the development of the national MDR-TB survey protocol, and we have also submitted an application for the procurement of second-line anti-TB drug to the World Health Organization Green Light Committee, and the queries arising from their response have been addressed. On this note, I would like to add that through the Global Fund Round 5 TB grant, a national TB reference laboratory and a network of 6 zonal TB reference laboratories are being supported to develop capacities for the provision of culture and drug susceptibility testing services. Indeed, the National Reference Laboratory at the Nigerian Institute of Medical Research has already acquired the capacity for the Heinz molecular technique. This is providing a window of opportunity for assessing rapid diagnosis of MDR-TB in the country. In partnership with the Institute for Human Virology of Nigeria, a second reference laboratory is being developed in the northern part of the country, while another intermediate reference laboratory, also of biosafety level 3, is also nearing completion in the southeastern part. And this is through the support of Global HIV/AIDS Initiative in Nigeria. Both partners are of PEPFAR Consortium. Through the PPM linkage, culture and DST services are being offered through the Zankli Medical Hospital in Abuja. It's a private institution. In addition, with the support of partners, infrastructural improvement of facilities are ongoing in 3 health institutions for the provision of specialized treatment and management services for confirmed MDR, XDR-TB cases. Suffice it to say that all efforts are being put in place to address human resources issues to ensure effective and efficient service delivery at both diagnostic and treatment levels. In addition to all these efforts, government is ensuring the strengthening and expansion of a quality-driven implementation of basic DOTS as a panacea to preventing the development of MDR, XDR-TB in Nigeria. We also subscribe fully to the implementation of all aspects of the new Stop TB control strategy. In the attainments we have highlighted so far, the support of our partners are highly appreciated. And among these partners are WHO, TB-CAP, USAID, Global Funds, CDC, IHVN, GAIN, the Damian Foundation, and ILEP. We recognize that the tasks ahead are still onerous and would therefore like to crave the indulgence of partners not to relent in assisting us to overcome these challenges. We also like to mention a few of these challenges, and they include 1, the completion of our reference laboratories, 2, training for service delivery, 3, procurement of quality-assured second-line anti-TB drugs, and the conduct of drug-resistant surveys, linkage to a supranational reference laboratory, and finally, the development of an effective, efficient, and countrywide routine surveillance system, and the establishment and scaling up of MDR-TB treatment centers. We look to our great collaborators for funding and technical assistance to enable us address these challenges. Thank you, ladies and gentlemen, for your attention.